Hi, this is Dr. Johnny Brennan doing a tips video for axiUm Ascend. I pulled up a test patient as a test student user logged in, and I'm in that patient's chart. I want to go through and just make sure people are aware of some of the charting capabilities. I think most are, but for those that aren't, this might be a quick, easy review. So I'm going to go ahead and select several teeth as we're going through an exam and simulate that I have several interproximal fills that I want to chart, and I know they exist in these teeth. When I go into Add Procedure, I'm going to go to my resin composites, and as I work through this, I'm going to start by selecting MOD. Now I can click each one of these, or instead of having to do 3 clicks, if I know it's MOD, I can just click MOD. Then I can apply to unset, which means I've now set up MODs on all of the other teeth. Let's say in my case, 20 was the only one that didn't have an MOD. So I went in, selected 20, and 20 was just a DO. I unselect mesial. Same, but on number 5, instead of DO, it's an MO, so I unselect DO. And now I can be done if I know the others were MODs. When I click done, it's gone forward and it's treatment planned all of those procedures the way that I had set it up. So the other that I would point out that's not used a whole lot is quick exam. So in quick exam here, the intended workflow, and we won't go too in depth, I think this deserves a much longer session, but want to encourage people to explore it a little bit more. The intended workflow for quick exam, it remembered from my chart the teeth I have selected. When I went over to quick exam, you can see 4, 5, 12, 20, and 29 are all selected. So I can clear that selection. And then I can work through my intraoral exam without necessarily having to stop and jot down on bits of paper and or go through the chart. I can quickly either translate from my paper or even in the intraoral exam, grab a tooth, select the condition. So if it's dental caries, I can grab its, let's say it's a mesial, an MO, mesial-occlusal dental caries. If there's any, I guess before proceeding. So once I do that, it's now pinned that condition at the top for number 2. If I go and I select another tooth, it's disappeared because it was only for number 2 that I did that condition. You'll notice it put a green dot up here, signifying that I have a condition charted for that tooth. Some of the red dots, those are for the treatment planned things that I have for those teeth that we did over on the charting through the more conventional treatment planning pathway. So I'm going to go through, and after I do conditions, if there's any existing work, like let's say there's actually, I think I said MO for the caries. So let's say it had an existing MO composite. Then I can treatment plan that. It's now pinned at the top. And then over here on the right side, I would treatment plan what I actually intend to restore with. So, and if I come in and do an MO, and let's say I had we said MO caries, so I'll leave it at that, just to not be confusing. So that puts it towards the top. You'll notice I actually selected anterior resin composite, but the system's smart enough to catch that I had selected tooth number 2, and so it changed it to a posterior resin composite 2 surface, even though I had selected the anterior resin composite 1 surface. So I know that could cause some confusion if people are looking for very specific codes, but you can very quickly jump to this, and it's going to compensate by reselecting the appropriate code and phrasing. So hopefully that helps people chart a little bit quicker, or at least begin exploring some of the features in Quick Chart or the regular chart.